And then, so the next step in that from coming together was the development of those guidelines. It sort of came from, started in one province, then morphed into the next, and then BC was the first one to sort of officially reopen. So those guidelines that had come, through it, then you kind of helped formulate those final guidelines that came nationally and went from you first, and then to the government to get reopened. So just maybe talk a little bit about, what was your experience like working on those guidelines, and then, what it was like working with the government, or, was there that feedback loop, or how did that kind of evolve as you guys got ready to reopen there at the start of June?
Yeah, and when you say me, I know you mean Club 16. I don't want to take credit. There's we have Rada Johal who has a heavy influence, in our president CEO Chuck Lawson as well, and then our executive team came together. We all came together and worked on this. And I think the best move we made is we right away built a strong communication and relationship with the health authorities in our area. And it was interesting because they did a lot of listening instead of a lot of telling, right? So we were saying, here are the things that we can do. Here are the things we already do as fitness centers. And here are the things that we think we should do based on the information that we see. And I share this in my safety training with all staff. And when we onboarded, I think it was upwards of 190 staff members for June 1st reopening, I shared this with them. We had heroes out there, essential workers, that had already established guidelines while the pandemic was going on, like, grocery store workers. And, I remind my staff, especially right before we opened, if you're nervous about this, understand that people are going to start coming to fitness facilities and they're going to get used to the new norm. Just like when you first walked into a grocery store and you said, oh, what is all this deckling? And why are there arrows on the ground? And why is there a bunch of plexiglass up? And why do I have to hand sanitize my hands? You started becoming used to that. So when people go to the grocery store, they're just used to that. So that's what we were trying to create and work with the health authorities on creating, and show that it's possible. So we did a lot of talking initially, and here's what we can do, and here's how safe we are. And they did a lot of listening, and we were pleased to see that once they came out with their mandates or guidelines themselves, Fraser Health and Vancouver Coastal Health, they mirrored a lot of ours. I think the Fitness Council of Canada's are above and beyond, for sure, what the guidelines are in terms of capacity, in terms of distance, hygiene, and protection. But we were pleased to see it sort of mirrored what we had already been working on and establishing with them. So we were very pleased with the feedback we got from the health authorities and their willingness to hear us out. They were willing to talk to us consistently, week on week. And here's what we're looking at now. And what's this contact tracing thing you're talking about? Oh, okay, well, here's actually how we can help. It's already put in place in fitness facilities, right? So that was great. It was a good experience for sure. And it actually prepared us in a big way to open up our doors on June 1st. Prepared me, I guess, to be honest with you, because pandemic, COVID-19, these are new things to me as the leader of operations. And it was great to be able to work closely with them on setting guidelines.
Yeah, and by contrast, for those who don't know what some of the other roles that I play other than Trainer Plus, I was organizing the Ontario Coalition. Ontario was the last province to open, and Toronto specifically was the last place in Canada to reopen. So it was really interesting to be on the other end of the spectrum where, the group, you guys in BC had already opened and under these guidelines, and then it almost like moved from west to east. Went through Alberta and Saskatchewan, the East Coast opened, and then Ontario and Quebec were the last ones. But it set a precedent for us when we approached the government here in Ontario to say, hey, look, this is what they've done in BC. This is the national guidelines that eventually it evolved into that national guideline FIC document. And what I remind people of when I'm in conversation with people who aren't in the fitness industry necessarily, and they're still skeptical of like the health and safety, is the fact that those guidelines that we sent to the government of Ontario were far above what they ended up kind of coming back with after they talked to their health people. And most gyms are actually following much stricter guidelines than the government kind of laid out. They're going above and beyond, as you said, what actually is being mandated from the governments, and really being very conscious of it. And really, putting that, minimizing the risk is the key term there. You're never going to eliminate it, but minimizing it with everything that we're doing. And I think that that's the key that people need to understand. I mean, I put out something comparing grocery stores and gyms, not saying that gyms are safer than grocery stores. There's inherent risks in both, but there's just so many ways that with the gym's guidelines, there was more things in place than you would have in a grocery store or a lot of other places. You know, like every time a piece of equipment's touched, it's disinfected. That doesn't happen when somebody picks it up off the shelf and puts it back in a grocery store. Or, you know, yes, there's decals on the floor and arrows, but not everyone's following those. I mean, every time I'm in the grocery store, somebody walks by me within 6 feet. You know, granted they've got a mask on, so that's a little bit different. And in the gym, it's people are like very, very, very conscious of it. You know, you see people walking towards you and go like, "Whoa, I'm within that 6 feet halo. I gotta move to the left and get around." So it's definitely was interesting to see the difference and being at the other end of it because it just made it. We just said, "Hey, look, this is what everyone else has done," and so Ontario just kind of went, "Okay, that looks good then." Other than putting in a few little hitches that we had to work through, but it was really interesting. Did you enjoy that clip? You can check out the whole podcast on our YouTube channel or wherever you get your podcasts. Make sure to like and subscribe if you want to get more content on the future of fitness.